and welcome to yet another episode of Doctors In. In this episode, we have with us Dr. Sebastian Mathew, who is a surgeon. Let's welcome him to the program. Welcome, Doctor.
Thank you. Welcome.
First of all, we would like to know more about you.
My name is Dr. Sebastian Mathew. My native place is in Vaikam, family Elambasheri, and I had my medical education near to this place, Kottayam Medical College. After my medical graduation, I have worked in 2 private hospitals here in Kerala, and then I was also more than 1 year assistant doctor in Kottayam Medical College of the neurosurgery, and afterwards I went to Tanzania, Africa as a missionary doctor. During this time I could get a lot of experience, especially in surgery, and this has really helped me for the operations and also something to do for my post-graduation, and I was lucky to get a post in Europe, in Austria, in Vienna University, and I could do my post-graduation surgery in Europe. And afterwards I got as a surgeon as a good post in Austria, and I have settled there. Now I am in Austria working more than 30 years. After some years in modern medicine, modern medicine is really excellent for emergency cases, accidents, and some operations. But for many cases like chronic diseases, the modern medicine has a lot of difficulties. So this has helped me to think something different. So then I got interest to learn holistic medicine, especially Ayurveda. And we know this India has contributed 2 great science to human world, Ayurveda and yoga. And so I started to learn Ayurveda, and I was lucky to meet Professor Gupta in Nadiad Medical College. So I did 3 years Ayurveda diploma training by him, partly in Nadiad and also in Germany. And afterwards we could start in Austria an Ayurveda clinic. So now we are running the clinic around 15 years, and we try to give the patients, treat the patients in holistic way, Ayurveda. And my wife, she is also from Kerala, from Pala, Naridukil family. She is also a trained yogist, yoga teacher, and we work together and to give the patients, treat the patients in a holistic way.
What is holistic medicine?
We have to see in Western medicine or modern medicine, we think about the physical problems of the patient, but the human being is not physical structure alone. We have something more than that. We have mind, we have spirit, and even according to Ayurveda, many of the disease begins in the mind level and slowly it comes to the body level. So if you treat the patients only in the physical level, it is only a part of the treatment. In holistic medicine, we consider all these factors. We have to treat his physical body, mental body, spiritual, then environment, psychological. We take all these in consideration and treat all together. That is why it is called holistic. And modern medicine is treating only part of the holistic, that is the physical body. So classical example is Ayurvedic medicine. Ayurveda considers treat for physical body, you have this massage, you have cleaning process, you have herbals, food, but they treat also for mental problems, mind, environment problems, with yoga and a lot of things. So all together comes in the heading of holistic treatment.
What are the advantages of holistic medicine?
If you want to be healthy, you have to think more than your physical level. I told you, some of the diseases begins not in the physical level, it begins in the mental level, And the advantage of holistic medicine is that we consider that we treat also in the mental level and then also the physical level. So we combine both, and that is the advantage of this holistic medicine. Modern medicine considers mainly only on the physical level.
Why you're interested in holistic medicine?
Yes, because of my years of practice in surgery, as a young surgeon, thinks that modern medicine is the best. We can treat all cases. After some years of experience, many of the operations really do not help the patients. According to international standards, more than 20% of operations really they don't help the patients. In Western countries, if a child comes from abdominal pains, they suggest you remove the appendix. Or if an adult comes with abdominal pain, if they scan and they find some troubles, for example, gallstones, they say this trouble is coming from the gallstones, remove the gallstones. And the patient go home with their complaints without gallbladder or appendix. So these things you experience every day. So as a surgeon, you think, is it correct? Can we do something more than that? This thinking helps to start in holistic way, holistic. So that is why I have started. In the beginning, I was not thinking for holistic medicine. I was thinking mainly modern medicine, surgery, how can you do good operations. That is one way it is good, but then to complete healing of the patient, we have to think in holistic way.
What are the treatments that you do?
I am lucky that I had my modern medicine I could study, and because the disadvantage of only if you do Ayurveda or complementary medicine, you should have first a good diagnosis. You should know what is wrong with the patient. What is the diagnosis? This helps the modern medicine. We have highly advanced technical equipments, and we can do blood examinations, we can do x-rays, we can do scanning, computer examination, all these things. So we know what is the problem with the patient. So that part is good for investigations and good diagnosis. What missing in modern medicine, once you know the diagnosis, especially in chronic diseases, there is no much treatment possibilities. So that you can take, for example, Ayurveda or some natural medicine, you can complement us and you can treat the patient. So it is actually a synergistic effect. Modern medicine helps for good diagnosis and also the prognosis of the patient. You can control it. For example, blood sugar. Whereas if you change the lifestyle of the patient, the food habit, you can do a lot of help. But how can you control it? That you need blood sugar control. So you have to consider both. You have to take from both sides. So in that way, we can help the humanity.
You told before that you are running a hospital for the past 15 years.
Yes.
So we would like to know more about it.
This holistic thinking helped me to learn something more. So that is why I have told you previously, I started to learn Ayurveda. I am originally from this place, and it is something in your blood, Ayurveda, yoga, all these things. So I knew there is something I can learn from Ayurveda, and I really started to learn more Ayurveda. And after my diploma training in Ayurveda, I thought theory alone is not enough. We have to do something, we have to start something. So we started an Ayurveda clinic in my place in Austria. This is the first time we started an Ayurveda clinic in Austria. When I started the clinic, many of my friend doctors, surgeons from Austria, they couldn't understand what is that. They said, it was 15 years back. At that time in Austria, Ayurveda was not very popular. They asked me what is Ayurveda, is something, some special food, some herbals. So I could explain them in detail slowly. And then also what helped me is some of the doctors in my hospital. For example, one doctor is a surgeon, he had a disc prolapse, and immediately he was operated because of disc prolapse. He recovered, and after a few months again he got a recurrence of disc prolapse. So he was really afraid for the operation, and he was crying like anything, because a surgeon, if he cannot stay and bend, it is difficult for him. So I said, please come to our Ayurvedic treatment, and he agreed, even though he didn't know anything about that. And we treated him Ayurvedic massage and special treatments Ayurvedic, and after 1 week he hugged me. He said, I am feeling all right, I can work again. So this news went in our hospital, and slowly it was a good case. And then many other friends, hospital patients came about this, and we started lectures about Ayurveda. So slowly this news spread many places in Austria.
Okay.
So we are getting good number of patients for Ayurvedic treatment. And another interesting story is my chief doctor. When I explained to him we are doing Ayurveda and all these things, he said, I am strict modern medical doctor, surgeon. I don't believe these things. At that time he was 56 years old.
Okay.
And he said, you can do that, he is not against that, but he doesn't believe all these things. And one Sunday after lunch at home, at his house, he fell down, and actually he had a stroke. One side was paralyzed, and then he was taken immediately to the hospital, and all treatments were given, and he had a small bleeding, but it could not be operated. And he stayed in the hospital for more than 4 weeks, and then he was into the rehabilitation center, and I went to see him, and in the rehabilitation center he started to really crying. He said, what I can do, I 56 years old, I cannot do any more operations, I have to go to retire. But the thing is, my side is almost weak. Even his face was weak one side. He couldn't even speak properly. And he didn't like to stay in the rehabilitation, because in the rehabilitation all other patients were seriously ill, and he was suffering from depression. And he said he is going back home, taking rest. Actually he went back, he stayed home, and then I went to see him. And I said, okay, now you have no more treatment, but why don't you come to our place for Ayurvedic treatment? Then he said, when you started it, I did not believe. So now I have no other treatment. So why don't I try that? I am ready to do that. And he came with his wife, and he came for Ayurvedic treatment. After 2 weeks, he was so happy. He said, I can slowly walk, I can improve my conditions. So afterwards, he went to retire. He retired. He didn't work no more in the hospital, because he couldn't operate.
Okay.
But he has become a good friend of me, and he was sending other patients to me afterwards, because he said he was open to say he was not believing all these things, but when it personally happened to him, and he was convinced. Now every year he comes for a few days Ayurvedic treatments, and we became really good friends afterwards. So all these things really encouraged me to take more time in this holistic medicine. And slowly, 3 years back, we have also conducted an international Ayurveda conference in Austria, first time, and we had more than 200 delegates from different European countries, from India, health department, from Ayush department, all people came. They have supported to do this conference. We have also from famous doctors, even from Mayo Clinic, and one professor from Mayo Clinic, he has also given a talk in our conference, and he said he is doing some Ayurvedic treatment for his post-operative patients. So the audience were very interested to hear what he was doing. He said thoracic surgery, they will open the chest. So after healing, these patients couldn't breathe properly and they have pain. So they were giving some Ayurvedic oil massage, herbal massage, and they did really a study about that. And he said the patients who got this massage after surgical, when the wound is healed, he directed to give them this special massage, and the improvement was remarkably high. So that is why he came from Mayo Clinic for this conference. He has presented this paper. So now the situation in Europe, Austria, people know about Ayurveda. Many have to like this treatment, but generally in Europe the problem is that all the medical treatments are covered by the insurance companies. So it is a big problem, and Medical Council and Health Ministry is not ready to cover for treatment expense for Ayurveda. We have tried many times, so they say it may take some time. Still it is as a medicine they have not yet accepted. Ayurvedic massage they have already accepted, but Ayurveda medicine they say they need more time. So from my side, or people who are practicing Ayurveda, we have to work hard. We have to convince the department, the government of European governments, and also Ayurvedic products, they are effective. It is really a hard work to convince the government. Then it can go very fast. The people are not used to pay themselves in Europe for the medical treatment because all the treatments are covered by insurance. So the first question when they come for Ayurvedic treatment is, what about the payment? Does the insurance cover? They say, if they hear no, then they say, I like it, but since the insurance is not covering, I don't like to have this treatment. So this is one problem. The second problem is Ayurvedic medicines. For 3 years back, the European government passed a rule: if a herbal medicine to be written as herbal medicine, it should be practiced or given to the patients more than 30 years. You should have evidence this was given to the patients more than 30 years. And from 30 years, at least 15 years should be given in one of the European countries. So this is extremely difficult. So we can get these Ayurvedic medicines not as medicines but only as food supplements. So that is another drawback.
Presently, what is the health situation in Austria?
See, what is health? We think health is if you are not physically diseased. That situation, physically not much diseased, it is very good in Austria. But real health, the health of the body, health of the mind, health of the spirit, environment, psychological, that is not really healthy in Western countries. The physical illness, when a child is born till retires until death, all the medical facilities is covered by the insurance companies. So if you are sick, there is no need to pay. You can go to the hospital, you can go to the doctor, you get the best treatment. So for physical illness, the people are far, far better than here. They go for sport, they prefer good food and good medical treatment. But the problem is that still they get many chronic diseases. And these chronic diseases, this Western medicine treatment alone is not needed. So most of the people suffer from many chronic diseases, especially cancer rate is very high, joint pains, rheumatic diseases very high, lot of skin diseases they have. So all these diseases, the Western people are suffering. We can see a lot of people coming from Western countries here for Ayurvedic treatment because they were getting free treatment in Western countries years and years, not much better. That is one situation. The second is their mental situation. In India, we are not alone. We are in the family all together. But in Europe, the individual is alone. when the boy or girl 12, 14 years, they don't stay at home. They go alone, they stay alone. So after some time, they feel empty. So then the kind of stress they have to find a boy or girl themselves. The parents just say, okay, if you find somebody, it's okay. So a lot of stress they have. Another situation is that they have a lot of work stress. The stress situation in Europe is really higher than in India. So these stress situations make a lot of sickness. You know, they have a lot of burnouts in diseases. They cannot sleep, they have fatigue. So all these problems, we say psychosomatic diseases. They are not psychosomatic diseases because of this stress situation. This is really high in Europe. And I think what we can do, especially in holistic medicine, Ayurveda helps especially for prevention of diseases and also in chronic diseases. And third pillar is psychosomatic disease. So Ayurveda can play a high role in Europe, not for acute diseases, but for prevention, for chronic diseases, and also for psychosomatic disease. Another interesting thing is in Europe, the people are growing older and older, 80, 90. So when they become old, nobody is there to take care of them because the children cannot stay at home, they go somewhere else for their work. So most of these people are alone, or if they cannot do it alone, they go to some special houses. So they feel alone there, they feel sick. So geriatric problems is very high, and in Ayurveda we can do a lot of help in geriatric.
Okay.
In that way, I think if the people made conscious about Ayurvedic system, it can do a good role in Europe. The Germany, a lot of centers giving good Ayurvedic treatments. In Austria is coming, but there are some other countries, in European countries, still lacking Ayurvedic treatment. And the difficulties I have told you, the medical council has not accepted as a medicine. Then this medicine we cannot import as medicine, only as food supplements. So there are some difficulties still, but if we go on fighting, go on doing good things, I think one day will come, then Ayurveda will spread all over Europe and the people will enjoy it.
So Doctor, that was nice talking to you. Thanks a lot for being a part of our program.
Thank you very much. Thank you for inviting me for this talk.
Thank you.
And wish you also all the best and success in your work too. Thank you.
So that was Dr. Sebastian Mathew with us. Until we meet next time, this is me, Naina, signing off. Take care.